Painful periods are extremely common. I have suffered from it, and if you have suffered too, this video is for you. 80% of the females, they suffer from some degree of painful periods or dysmenorrhea in their lifetime. This leads to a lot of people taking leave from their office during the period time. If we know how to take care of our painful periods, it will lead to increased productivity, and we will talk about how in this video. Why are the periods painful? There are two types of dysmenorrhea or painful period, primary and secondary. So what is a primary dysmenorrhea? Primary dysmenorrhea is when you have painful periods but there is no disease in your uterus or reproductive system. While secondary dysmenorrhea is when you have got some pathology like endometriosis, adenomyosis, fibroids, IBS and so many other conditions which can lead to painful periods. Why do we get primary dysmenorrhea? So what happens is that every period cycle, the endometrium or the inner lining of the womb thickens and it reaches up to a point where the hormone progesterone drops in our body and the endometrium is shed off. When the endometrium is being shed off, body produces a hormone which is called prostaglandin. Prostaglandins are the same compounds which are produced when a lady goes in labor. So what prostaglandin basically does is that it makes the uterus contract. In case of a labor, it contracts to help the uterus get the baby out of the body, while in period it helps the uterus contract and get rid of the thickened endometrium. So prostaglandins makes the uterus crampy and that leads to painful periods. Thicker the endometrium is, more painful would be the periods. Can primary dysmenorrhea be prevented? It has been found that women who are physically active, do moderate to intense exercise and who maintain ideal BMI or body mass index or ideal weight, they are less likely to have severe dysmenorrhea in comparison to those who don't exercise, who live sedentary lifestyle, and those who are either underweight or overweight. It has also been found that if you continue doing exercise during your periods, the period gets less painful. So do continue with your exercise during the periods as well, and there is no need to stop it. What are the other effective ways in which the painful periods can be taken care of? Hot fomentation, using a hot water bag or something like that, a hot heat pad over your belly would relieve you of your pain which you have due to periods. It is something which is scientifically proven in various studies and should be used as a first line treatment in management of your painful periods. Aromatherapy, acupuncture, acupressure has been suggested by alternative medicine proponents. But there is not enough scientific evidence to suggest that they will definitely help you. But there is no harm in using these methods as well, as they are non-invasive and non-dangerous for our body. Now, if we talk of definitive treatment of primary dysmenorrhea or painful periods, then the most important is NSAIDs or compounds like Brufen, Ibugesic, Compiflam, Voveron and others, which basically what it does is it relieves the symptom which is caused by the release of the prostaglandin. So that is how it works, and it is very effective. Taking NSAIDs during period for 2-3 days is safe even in long run and can be taken after consulting a doctor. Paracetamol is not as effective as NSAIDs, but it can be definitely used in case of girls or ladies who have any contraindications to NSAIDs. The third group is oral contraceptive pills. It has been found that oral contraceptive pill helps in relieving the painful period. And how does it work? It has been found that oral contraceptive pill thins the endometrium. As the endometrium is thin, less of it is shed during the periods and the prostaglandin release is also less. So that leads to painless periods if you are using oral contraceptive pills. One interesting trivia is that It has been scientifically proven that post-delivery, whether it is cesarean section or vaginal delivery, the ladies find that their primary dysmenorrhea has eased off, as it happened in my case. Secondary dysmenorrhea, which is after having some pathology inside, like I mentioned earlier, endometriosis, adenomyosis, fibroids, polyps, cancers, so many other diseases which can, ovarian cysts, which can cause painful periods. They usually happen after the age of 25, but it is not a rule of thumb. It can happen even earlier as well. So if you find that you are having painful periods which are really painful and you don't get relief even after taking NSAIDs, it is good time to meet a gynecologist so that she can get you investigated or he can get you investigated and start the treatment accordingly. I hope that you found this video useful and that will increase your productivity during the time of your period. If you wish to learn more about your body so that you can use it more efficiently, productively and in a healthy manner, do subscribe to the channel and I will get back to you about more such interesting topics. Till we meet next time, have a great week ahead. Bye bye.